behalf of Access to Integrative Medicine Health Institute and the GW Office of Integrative Medicine and Health, welcome to A Mindfulness Experience. AIM is a nonprofit organization with the mission to provide vulnerable and low-income communities with access to whole person health and wellness. The GW Office of Integrative Medicine and Health promotes integrative medicine by providing learning opportunities to health professionals and healthcare consumers. Today's facilitators are Dr. Misha Kogan, a leader in the field of integrative medicine and author of the new book, Medical Marijuana, Dr. Kogan's Evidence-Based Guide to the Health Benefits of Cannabis and CBD, a seminal text that demystifies marijuana and other forms of cannabis, and Eileen Yager, a pediatrician and clinical professor of pediatrics at the University of Colorado School of Medicine. Dr. Kogan, over to you.
Okay, thank you, Tatiana. Okay, so today I was thinking that I'm going to cover some of the COVID-related topics, but I realized that they highlighted the book. The book just came out on Tuesday, so I figured I better talk about something book-related since it's kind of, I guess, customary or so. Anyway, so here's what I decided we're going to do. Instead of me talking about THC, CBD, the common, we'll do two things. I'm going to talk about stuff you've never heard of. And then meantime, if you have questions, any questions related to medical cannabis, throw them in the chat. And then we'll see where we'll end up in about 20 minutes or so. Dr. Yager, how much time do you want? Let's start with that.
I could take anything up to a half hour. I could do
Perfect.
20 minutes.
We'll give you 25 minutes. How about
two practices and one breath.
Perfect. So we'll make sure we end sharp at 2:30.
Okay.
And then transition to you. Okay.
Fine. Thank you.
So with that, we have about 25 minutes. So first of all, here's what I'm going to do. I'm going to put names in the chat. And I want everybody to respond whether you've ever heard any of this, because that'll guide me a lot as to what we're talking about. So take a look at the chat. I put 4 types of 4 different cannabinoids. Have you ever heard any of this? No. Okay. Let's just okay, I see a lot of people shaking. Okay, 1, 2 yeses. Okay. Well, Julie, but of course. Sorry, I couldn't help that. Oh, wow. Salome, you know about this stuff? Very good. No, great. Okay. Well, Delta doesn't mean much. There's Delta 9 is the regular THC. It's a Delta 8 and Delta 10.
Oh, okay. I know only about THC.
Right. Okay. All right. So that's good. So I'm going to put something up. Now, I don't recommend using this website. I'm simply putting it up as to show you what's out there. So this is commercial website. And if you come to this website and you look at this Delta 8 THC products, if you read about what Delta 8 is, the Delta 8 is a synthetic form of THC, which is THC is a psychotoxic, psychoactive molecule in plant cannabis. Delta 8 is much weaker than THC, but according to public opinion on the matter, it produces nearly same high at the higher doses taken. Notice what this is. You go to this website, you click purchase, and they ship it to your home. So this is derived from CBD. And according to this website and many others, you can purchase this legally without card, can be shipped across the borders of states. The reality is, though, the feds making it very clear this is all illegal activity. But there's no precedent of blocking this. There's no precedent, and nobody knows what to do with this. The FDA has no stand because they have no idea. It's a brand new product. The synthesis of this compounds is less than 2-3 years old. Nobody knows the quality of this product. The main problem is simple. Because it's a very complex processing, it requires highly dangerous substances, solvents, thinners, all kinds of toxic and noxious material. The end products are hard to vouch for. However, the amount of growth that these companies are selling this stuff are seeing is unprecedented. Why? Because basically, even if let's say you're in a state where you have no access to cannabis, you can buy for relatively low cost. It's actually, look at the prices. Those of you who know what the cannabis prices should be will realize that it's not that expensive. So for the prices of these products, people can access it, and so I'm going to tell you just a couple of words about some ingredients. So this is Delta 8, which is most popular. The newer compounds, it's THCO. Now, THCO is very much closer to THC. It's a lot more potent than THC8. It's a little less potent than THC9. It's the same exact process. It's also derived from CBD. Now, THCV is a mildly psychoactive. It's actually present in the plant cannabis. It's an actual live cannabinoid, so to speak. It's not synthetic. It's simply derived from cannabis. But it also can be derived from hemp. That's how they legally sell it. Of course, they also sell CBD, CBG, and all these other molecules. So I'm going to stop at that. What's essential is just to know these names, not to be scared of them. Know that the quality is potentially a problem until there is some regulatory mechanism or until we see how this market stabilizes. Because in reality, probably some of these products are fine if they're, but it's not so easy to ascertain the quality. But more importantly, the concern is not just the quality of a particular one company, let's say, but consistency of products. It hasn't been enough experience with any of them. The thinking is that they're going to have exactly same therapeutic value, meaning they just, let's say THC8, it's going to be 2 to 3 times less potent than THC, but it's going to have exactly same benefits as THC does. It's yet to be determined. There's no studies done. We don't know. It's simply all speculation. Its speculations are based on the fact that when people take these products, they say that they feel the same as if they take THC. Meaning they can feel sleep is better and pain is better and anxiety is better and all of those things. Again, you leave it at that. Our current positions, so my position that's published out there, position of several nonprofit organizations, that people should stay away from Delta 8 until there's a clarity on 2 things. Clarity on the quality and a clarity on regulatory structures, until we know what the feds are going to say as, is this okay to sell like that? Okay, so I'm going to stop sharing and I'm going to come back and we'll do questions. Before we do questions, diversion in the news, just for a minute. You probably heard the VA study was just published on 500,000 vets, showing that 1 dose of J&J at this point is 3% effective. So basically no effectiveness at all against Delta. Almost 0. So they're scrambling to figure out what to do. The publication was yesterday. Thinking is that the 2nd dose would be a lot better. So after boosting, and apparently that is a drop. So back 6 months ago, J&J efficacy in the same cohort was determined to be 88%. So it was 88 to 3. It's like basically complete disappearance of efficacy in 6 months. It's pretty unsettling. What they're going to specifically recommend, I don't know. You probably remember me. I was never a fan of J&J because of I was afraid that it's just more side effects. And also I disliked the initial numbers. They were not as great. 88 is actually a lot better. I remember numbers in mid-70s. But anyway, so that's the current quick update on that. All right, let's do questions. So first question was, what are some reliable sources of CBD? I'll give you 2 brands that I can vouch for. Well, I'll give you 3 brands. How about that? So I'll give you 1 brand. I'll just give you home pages in the text. So this is 1 brand coming to the chat. This is a small artisan company. They're very limited in what they produce, but they've been around for a long time, very high quality. And then they also produce, that's one company. Then, so this is another one. That's a newer company. I love their, how they trying to set up business. If any of you are on limited income, they offer up to 40% discount on all their products, but you have to prove that you're on limited income. So if you go there, you'll see a compassion program, and they describe what that means. That's one of the main reasons I start partnering with them. I have partnership with all these companies. I'm not going to tell you what the partnerships are. It's not appropriate for this presentation, but if you reach out to me personally, I'm happy to share you what that means in terms of benefits for patients. And then there's also a very good CBDA company, which, so CBDA is think of it as an alternative to Motrin. It's about 10 times more potent milligram per milligram. So if you're taking 800 milligrams of Motrin, 80 milligrams of CBDA will have almost identical impact on pain and inflammation. So this company also does offer some discounts as well, but they have to be through me. The same with Lily Hill. I don't think they offer direct large discounts like what Miriam shop does. The last one has been one of the longer ones. This one is not so easy to obtain in terms of direct purchases, although I think they do have direct markets. So this is another brand that I've been using for quite some time. Notice that I did not put Charles Webb. I did not put CBD Plus. I did not. The reason is that all those brands are heavily, heavily overpriced. There's nothing wrong with them. They're perfect. They've been first on the market. They're high quality. They're too expensive. Okay, that's why I have nothing against them. I actually think some of them are probably even better than the ones here. But you know, you have to sort of price it, so to speak. I also feel, honestly, in the future, what I hope we will see is not like some preferred makers. I think we're going to have a lot of artisan companies that are going to work with like a, say, compounding pharmacy and then deliver products to them, and you talk to your doctor and it says, why wouldn't we order 4-to-1 ratio of whatever, and then it gets compounded for you. So Miriam can do this right now. Unfortunately, the way they currently operate is just crazy expensive when you ask them to do something like this on a small batch scale. Hopefully future will be different regarding that. Okay, that's for sources of CBD. Now, of course, sources of THC, you heard me just say that. I don't recommend anybody getting any analogs of THC online. You need to have a card and you need to have an access to a state-controlled process. If all 3 states allowing cannabis sales now, you need to talk to your doctor. If I'm your doctor, talk to me. If I'm not, talk to whoever you need to talk to. I'm happy to see people, but you know, it's a new relationship if I don't know you, clinically speaking. So that's that. Great question on use of topical. That's one of my favorite uses of cannabis, mostly because chances of side effects are pretty small. And I have my main mantra with cannabis, and it's highlighted in the book in probably a dozen places. Start low, go slow, and the third one, those are the very common ones, but the third one, deliver where it needs to go. So you want to put the cannabis exactly where you're targeting the tissue. So Eileen, if you're using it for knee pain, topical is the best. Now, it's not always going to work. For a lot of people, topical is not going to work. It has to do with absorption. It has to do with the fact that often you cannot get concentrated enough products. Unfortunately, topical market is misunderstood and not used appropriately. In the book, I describe why in great detail. Main reason, the concentration is not enough. I think that you should never buy any topical that has less than 300 milligrams of THC, or if it's 1-to-1, 300 milligrams of total, because you simply need, your concentration has to be high enough to reach the potency in the tissue where you put it. It's very unlikely to have side effects from topical unless you smear it on a large surface, and then you can have a systemic impact. So getting dizzy from small topical application, I have not seen it, but it's not that it's impossible, it's possible. So Eileen, maybe you're extremely sensitive to THC. In that case, you should simply just use CBD alone. CBD alone for inflammatory states will work, but don't expect it to work right away. It'll take a few weeks before it'll kick in.
Actually, what I'm using is, it started to work right away. And I know the receptors are very superficial. So within 2 to 3 minutes of my applying this topical CBD, the pain goes away for 4 hours, then it comes back.
Perfect. Well, here's a good example of, and that's exactly what I see with my patients.
The brand is called Mary's Nutritionals.
Okay,
it's a local Colorado company.
So that's what I like. I really, you asked me for the brands, but I'm kind of was a little hesitant to share it in the beginning. I want people to know their local brands. Why? Because Lily Hill will not be able to ship it to a million people. And I much rather you use a local artisan brand than everybody's doing it, right? They're all these companies. The problem is you want to have a relationship with the brand. You want to know that they're good quality. Ideally, they're local to you, so you can go and visit them. You know, the future has to be just like we're buying food. I'm very clear on that. You know, you're buying a food from hopefully local grocery, or if it's not local, at least you have a sense of like the company, right? You have some kind of a relationship with the product. That's what I hope, because in the reality, in the future, I hope that the market is not going to be grabbed by, you know, half a dozen large companies that's just going to dictate everything. Because the small companies can move differently. They can have a personal relationship with their customers. They can cut corners and have certain costs dropped. The large companies, not so much. Okay, all right, good. But yeah, topical is very good sources, especially if you're afraid of systemic side effects. Like you don't want to eat it, you don't want to smoke it, you can still do it topically. And then I mentioned that we already kind of discussed the main indications, but even skin conditions, it works sometimes amazing. Eczema, psoriasis, anything that causes itching, you can try it for, especially THC has a very strong antipyretic effect, especially when you can deliver it on a location. If your whole body is itchy as well, you need a systemic intake. That's going to be more complicated. Okay, all right, let's go back. I'm going to go into questions now. We have about 10 minutes. Can one take Tylenol for pain after COVID booster? Sure. There was ideally, like there was in the beginning, there was an idea that nobody should take Tylenol or Motrin around the vaccine. I don't know what it was based on. I think it's a general statement that was never supported by evidence. If you need to take, I would not take the Tylenol for low-grade fever with the vaccine because it's just your immune system responding. You don't want to control that. You want your immune system developed. So if you have a low-grade fever, it's because your immune system doing what it's supposed to do. It's reacting normally to the shot. You know, if you have severe pain or your fever is 103, well, of course, I mean, we're not talking about that, right? So no problem with that. Jada, so we're working on Bread for the City. Unfortunately, there is no funding. That's the problem. So we're trying to get a funding to restart the services. I can only tell you, stay tuned. To my surprise, our hope was to get an article published on our work and then go to a couple of big donors to ask based on the publication. We're having a hard time publishing. We can't quite figure out why. We submitted to 3 different journals, got 3 different rejections. So we're not going to give up, you know, even though 3 is a charm, is not a so charm for us, but we'll get there. I have no doubt. Okay. All right, let's go to the next question. What mood disorders qualify for the booster? That's a great question. Benita doesn't ask stupid questions. I don't know. Don't think any. Eileen, did you have anything to add to? I mean, you know, if you have other disorders that are not mood disorders, they can qualify, but I can't quite think of a mood disorders to be a particular qualification for the booster.
Can I point out something, Dr. Kogan?
Sure.
Hi. So the reason I'm asking the question is that apparently they have said that mood disorders like depression qualify for the booster because those individuals are apparently at high risk for COVID. Not quite sure I understand this, But that aside, the question is then, what about people like me who have PMDD? That is a mood disorder. Like, I'm a little annoyed that CDC is not clearly defined.
Yeah, look, you're not the only one with that annoyance. Well, they actually, let me reframe this. Here's what that's how I read what was posted. They basically saying, if your physician believes that your condition puts you at the higher risk, go get it. That's how I'm reading it. I mean, you can, in that way, any stress-related disorder increases your risk, right? So if you have any chronic condition that changes your immune system and changes your adrenals and your stress response, of course, it's going to be higher risk. I'm just a little perplexed by, because, you know, the original booster statements were immune compromised 65 plus. You have to have an actual, there's a list of what immune compromise meant. Definitely none of the mental disorders, mood disorders, they were there. But the later statement was added that it could be any condition as long as physician thinks that there is a disruption in the immune system. And in that sense, yeah, I mean, anything can qualify. But you know, I'm confused too. Here's how I take it all now. This is some weeks in, I think 2 or 3 weeks. If I have a patient in front of me and I'm actually somewhat worried that immune system, and I don't really care what the age is, then I would give a shot without hesitation, because I would presume that my clinical judgment is more accurate than any CDC recommendations. Can I say that in public? Oh, well, I said it. No, but seriously, I mean, you know, CDC is not they're not a clinical entity. They can summarize the data, they can offer guidance, but they're not to substitute for physician's judgment, right? Because the physician, your physician ultimately knows who you are, not CDC. And that's really, I think, the crux of this important question. Thanks for putting it up there. All right. Cecilia, is it okay if I bring this question up? Was this really personal, or can I talk about it?
Sure.
Okay, so it's a really good question about fluad quadrivalent flu shot, which is a high potency shot for 65 plus population. So the ones we offer at the GW are single vial. There is no mercury in them. Over the last couple of years, there were several preparations. There were 10 milliliter vials or 10 dose vials. They all contain mercury. So if you really want to get a mercury free, the question you have to ask when you go in there, and fluad, don't assume that the clerk in the pharmacy where you're going to get your flu shot knows what you're talking about. If you tell them, I want to get just fluad quadrivalent flu vaccine, which is supposed to be single vial, don't assume that that's what you're going to get. You need to say, I want high potency single vial dose. If you say those words, they gonna most likely go to the pharmacist and get clarification. Okay, that's the sort of the way in. Clarify that it's a single vial. If they sort of walking around you, just ask them to show you the vial. And it's going to look like a kind of a, it's not a syringe, it's a container that a needle can be attached to, in essence. Some of them, I think they actually, I'm trying to remember if they have a needle on it or not. I don't think so. I think they attach the needle and then they do the injection. If it looks like they have to draw it out, and there's multiple doses, stay away from that if you're really concerned about the thimerosal, which is mercury containing substance. Yeah. Was there a question?
Mikhail, the fluad box has on it senior and quadrivalent, and it shows the single dose. So,
correct. That's exactly what I was saying.
You can see the box before
right.
you stop.
Right. Exactly. Yeah. Yeah. But again, don't assume that the clerk, when you say fluad, often pharmacists have only one choice for high dose and one choice for regular. And they may not actually have the fluad. There are others available. So
no, you fill out a questionnaire and you can register online too.
Good. Thank you. That's important. By the way, remember what I was talking about? Now is the time to get a flu shot if you're going to get it. that's a whole separate conversation. If we want to have that conversation, we can have it next week or whenever I'm talking. I don't think I'm talking next week. I think I'm taking off next week. Boy, a lot of people were commenting on THC related substances. Very good. Okay. Cecile, the lacing of cannabis is still a huge problem in the black market. There's a lot of products out there that are laced with not just PCP, with all kinds of stuff. So that's why actually harm reduction wise, in some funny way, I'm happy that this new product's coming on market, because they're going to be sold through a better quality distribution channels and they're not going to be laced. But the reality is, you know, I can say that in small group like this. I wouldn't say this in general public, because it's actually not a formal statement yet. We need to see more data on this, but I think in the long run, it's a positive development. We're going further and further away from the black market on cannabis, on marijuana, and I think that's a good thing. Because the website I showed you is legit, and the makers, it's just the e-commerce website, but what they're selling there is tested. I mean, they're telling the public that they're testing it. Do they? I don't know. All right. Can you say anything about local vendors of cannabis? So you cannot buy any cannabis on the fresh market, right? Just you guys clear on that? That's not cannabis, that's CBD. I cannot say anything unless I know what the brand is. I'm very careful not to badmouth any partner, any industry partners, because in reality, I think there are a lot of really good players and just a handful of crap. And that just sends a very bad rep. So Cecile, I don't think I can satisfactorily answer that question for you. You can use the brands that I put in the link if you're more concerned, or you're going to need to do a little more detailed analysis. Okay, locally, what about cannabis sold at Tacoma Farmers? So it's probably CBD brand. I don't know that. I don't know what cannabis. Is it a topical?
It's both, but it's a brand of CBD. Yeah, it's definitely CBD.
Yeah, so it may be perfectly great local brand. I don't know. See, like I'm not in a position. I developed few relationships, and that's what I'm sticking to. That's why I said to everybody, research this a little bit on your own. If you feel that it's a good local brand and you know somebody who uses this and you have good reviews, you can always do the following. You can always request. This is the test. You can always request a complete safety data sheet and the analysis of a last batch. If they immediately provide you that, it's a most likely great product. Okay. Oh, we're running out of time. Okay, I'm gonna quickly scan through and finish up. Yep, exactly. So there's a huge interest in topical CBD in dermatology, and Dr. Adam Friedman is the head of GW Dermatology. Is a kind of that's his research interest and also commercial interest. There's a big commercial interest in pharmaceutical industry to develop topical FDA-approved products, because what we're discussing is not FDA-approved drugs, right? So they're just botanicals that are not regulated. It's an important distinction. We need more specific products that are more, because, otherwise it'll never move towards insurance coverage. It'll always be this kind of, an herbal only direction. Okay, new thoughts on Pfizer vaccine for kids? Nope. Even though got approved, I don't have anything new to add. I'm still extremely guarded. I'm still worried that they're just pushing the agenda. And even though I agree that the public has to be vaccinated to protect others, but unfortunately, because the safety data is still unclear, it's hard to say. I'm neutral. I'm still neutral. I'm not a pediatrician. Eileen pediatrician. If she wants to add something, by all means. But as a non-pediatrician, I'm feeling uncomfortable giving public my opinion on this topic.
The dose is a third of the adult dose. It was 90% effective, the Pfizer vaccine. My granddaughter is going to be first online to get it once it's approved.
Great.
Because the children may not have it, they may not have symptoms themselves, but they are spreading it.
Right. Yeah, that's the real point here. I mean, if we're to move towards as many people having immunity, we have to vaccinate whoever we can.
Right.
It gets a bit more complicated on individual level. One of the issues with safety is simple. Well, not so simple, but simpler. You know, kids, especially kids with a hyperimmunity, like asthma, allergies, the data that I reviewed was not satisfactory. There were spikes of some immune reactions. They were mild, but nonetheless, it's not very clear to me. And that's why if you carefully look at who said what in terms of CDC, basically when they come out of that meeting, they said, look, we don't have enough safety data. And the safety will be, and we will approve and we will look at what happened. That's exactly what they said. To me, that's kind of scary statement, basically saying we don't have enough safety, so we will approve the vaccine and then we'll just monitor it aggressively. They're making this statement based on the public good, not based on an actual individual safety. Usually it takes longer to approve something. I think they're just running out of time. There's a fear of things getting out of hand come winter. That's my take on all this. Otherwise, I'd say they'd probably take longer to look at more data and then get that data to us, because I haven't seen that data. All I've seen is not enough, and that's what CDC said. We just, you know, but what they do see seems to be okay. It's just there's not a lot of that being provided. Okay, so enough of that. I think we're done with questions. The rest were kind of individual questions, so I'm going to just address them individually. Eileen, sorry, we took a couple extra minutes, but I think you'll be okay, right?
Don't worry about it. I know you long enough. I forgive you. Okay, welcome everybody. And what I'm going to do today are two short practices and then one breath at the end. These are both practices to relax. They're very successful. I recently used them in the meditation group that I lead at Children's Hospital, and everybody loved them. So some of you may be familiar with at least the first one. It's called soft belly breathing. And these are adapted from practices that were written by someone else. I didn't make them up, I've modified them. And the person who put this together is Dr. James Gordon from the Center for Mind-Body Medicine. But this is my take on it. And practicing relaxation decreases levels of stress, as you know, increases immune function, can lessen pain, decreases anxiety, improves your mood, and lets you tackle your emotions more easily and gain perspective on every aspect of your life, and therefore feel less overwhelmed. It's a good way to reduce stress. And the soft belly is only one form of relaxation, because there are many, many forms. So Janet is going to send you a handout afterwards. And on the handout, there are actually two versions of this. I'm going to do the slightly longer one, but if you want to do the shorter one at home, you can. So get comfortable and sit with your back straight. You can sit in a chair or on a cushion or against the wall, whatever you want, but your back needs to be straight. Take a deep breath and allow your eyes to close. Now, if this is not comfortable for you, then find a place in the lower half of your vision. Keep your eyes half open and look at something that's low down and stare at it. The idea is not to look around at different things, but it's better if you can do it with your eyes closed, although you don't have to. Now start to breathe in through your nose, in through the nose, and out through the mouth. Now that's not our typical pattern. It's a very relaxing way to breathe. In through the nose and out through the mouth. And let's do that. And let your belly be soft and relaxed as you do. Having a soft, relaxed belly helps to activate the vagus nerve. The word vagus means wandering in Latin. This is one of the longest nerves in the body. It wanders up through the belly, through the chest, up to the brain. And it has many quieting kinds of effects. It quiets the body, it slows the heart rate, it improves digestion, it lowers the blood pressure, It helps muscles to relax, and it also quiets the mind and reduces activity in the part of your brain that registers fear and anger. That's called the amygdala, and that controls them. So the vagus nerve is really like the antidote to the fight or flight response, which is the stress response. So if your belly is soft and your abdominal muscles are relaxed, then all the other muscles begin to relax as well. So continuing to breathe in through the nose and out through the mouth, feel the muscles relax in your abdomen. And now feel the muscles relax in your pelvis and your buttocks. Just sink into the chair or cushion. Feel the muscles relax in your legs and feet. Your legs may feel heavy when you do that, that's fine. As you breathe out through the mouth, drop your shoulders and lower back, and your lower back and upper back should start to relax too. With each exhalation, concentrate on letting your muscles become very soft. Now let the muscles relax in your chest and your shoulders. Dropping your shoulders is a very good general way to help your body relax. Let your muscles relax in your hands and your arms. And your arms may feel heavy when you do that, and that's okay. Now feel the muscles relax in your neck, and your head may want to flop sideways or forwards, and that's fine. Relax your face muscles. Maybe your mouth will want to hang open a little. That's okay. Muscles around your eyes, soft, and your head. And now feel your whole body relax with each exhalation. And one thing that helps when you do this, if you'd like, as you breathe in through the nose, you can say to yourself, soft. And as you breathe out through the mouth, you can say to yourself, belly. So it's soft, belly. That will encourage your muscles to be relaxed. And if thoughts come, which they very well may, let them come, let them go. Just recognize them, don't get upset at yourself, and just gently bring your mind back to soft belly. And let's do that for a few minutes. Now become aware of yourself in the chair or on the cushion. Feel the furniture against your feet, against your body, and feel your feet. If you'd like, you can wiggle your fingers and toes. Take a deep breath, and as you breathe out, open your eyes, let your attention come back to the room where you are, and sit quietly. It's very important anytime you do any kind of practice to, at the end, sit for 30 seconds to a minute before you get up to move on to your next activity, because it can be very jarring to your system if you leap up and do something else. Your body has to sort of absorb the calm feeling that you got from the practice. So this is something that you can do for a few minutes, as many times as you can. Obviously, you shouldn't do it when you're driving, and you shouldn't do it when you're having a conversation with someone, because the idea is to turn inward and be quiet. But on the handout, you'll also see, besides the short version, a little thing about home practice. It's a very nice and simple thing to do. And just in general, breathing in through the nose and out through the mouth is a very relaxing form of breathing. Okay. Let's just sit quietly for a few seconds, and we'll move on. Okay, this next practice or meditation is called a practice to welcome everything. And it's based on, again, I adapted it from a meditation that was developed by a man named Frank Ostaseski, who lives in San Francisco and was the founder of the Zen hospice situation. He is a Zen practitioner, and this is a lovely practice which is very open. When I did this last week with the meditation group that I lead at Children's Hospital of Colorado, everyone loved it. They didn't want to end it at the end. So to welcome something, that is a practice to welcome everything. To welcome something doesn't mean we have to like it, and it doesn't mean we have to agree with it. It just means we have to be willing to meet it. We temporarily suspend judgment, and we're open to what's occurring. So first, sit down in your chair or cushion with your back straight. Relax and focus on your breath and on your body. Let your eyes close. And again, if that's not comfortable for you, keep your eyes half open, looking at something in the lower part of your visual field. But it's better if you could close your eyes. And let your breathing be very natural. Don't try to change it. Begin by being aware of the various sensations in your body: pressure, movement, tingling, the feel of the air on your hands and face. Just feel the waves of sensation. Now, let go of the idea of arms and legs and a body. Become aware of the area above your head. How far does that space extend? Let your awareness sense what's to the left of you. What's to the right of you? Let your awareness come into the area below your body. Is there any vibration in your feet or in the floor? Let your awareness extend to the area behind your body so it fills the whole room. Let your awareness be aware of what's in front of your body, extending out as far as it possibly can. So that there's a sense of openness, of boundless space, and all of the activities of body, heart, and mind are appearing and disappearing in that open, welcoming space. Allow all experience to arise without any interference, no inside, no outside. Look and see the difference between being lost in thought and being mindful of thought. It's like when a sound occurs in the room or a bird flies by, you just notice the sound of the bird. You don't think it's you. Let it be that way with your thoughts and sensations. Everything coming and going in a vast open space. It can be helpful to think about what happens when you walk into a room. Most people see the chairs or tables or the objects in the room and fail to see the space. Let yourself be aware of the space surrounding all the activity, all the coming and going. Remember, whatever we can give space to can move. Keep allowing all the thoughts, all the sensations, all the feelings to rise and disappear in the vast spaciousness like clouds in the sky. Finally, let your attention come to the awareness itself, vast, transparent, clear, not disturbed by anything that's coming and going. It's like the background to everything that's happening. Welcome everything, push away nothing. Now become aware of yourself sitting in the chair or on the cushion. Feel the furniture against your body and feel your feet. Wiggle your fingers and toes if you want to. Slowly take a deep breath in. And as you breathe out, open your eyes, sit quietly, just breathing naturally. Some people have told me that as they do this practice, each time they do it, they become more aware of the space around and the fact that we are just something small in the middle of something that's vast, and that we're all connected to the space. And somehow, if you feel that you're part of something bigger, it doesn't take your problems away, but it gives them a different perspective when you finish doing practice like this. So I suggest, if you like it at all, practice it, and you'll find that it's a different experience each time. Okay. And the last thing I want to do is a very short breath practice to relieve stress. This is something that I have taught to doctors and nurses, for example, when they're like standing outside a patient's room, ready to go in, or if you, let's say, have a task to do on your computer just before you start to do it, or if you are about to sit down and talk to another adult or to your child. This clears the mental circuits and allows you to start with a fresh mind. And it's very, very simple. It's the up and down breath. So for the first, let me say it first and then we'll do it. For the first breath only, blow out the stale air through the mouth. Then through the nose, take a deep breath, inhale fully, filling up your lungs, and hold the breath at the top for the count of 3, roughly 1 per second. Then exhale through the nose fully and hold the breath at the bottom for the count of 3. And we'll repeat this 4 times. So only the first time we blow out the stale air. Now through your nose, fill up your lungs and hold the breath at the top for the count of 3. And now exhale fully. Hold at the bottom for the count of 3. That's it. That's the breath. So let's repeat this 3 more times. Last time. And when you finish the last breath, just sit quietly, breathing at your own natural pattern. I highly recommend doing this when you're about to start something different, because it really does, it just clears the mental circuits. Okay. Does anyone have any questions? This will be on your handout also. Okay. Back to you, Misha.
Thank you, Eileen. Wonderful practice. Thank you very much. Of course, now I want to sleep. It's always the case. By the way, usually if that's the case, it
I
means
think
that-
Janet is going to send these out sometime today.
yeah, I think there, and also the recording will be there, so people can always go back and follow you again on the recording. We can probably stop the recording, by the way. Okay.